How do I want people to see me? I want people to look at me and just see a person that loves life, a person that enjoys people, enjoys working with children, enjoys her family. I want you to look at me as just any other person, minus sickle cell. I do see myself as a warrior. I see myself surviving the disease, living with the disease, but not more so than anybody else, battling something else. Just being who you are, being strong about your circumstances. So that makes me a warrior within my own little world. Being at Mount Sinai, it makes me feel good about the future.
New York City has more people with sickle cell disease than any other city in the United States. And they are either not connected to care, not connected to the right experts, not getting what they need or what they could. A lot of the patients we see think they're at the end of their rope. They're being told there's nothing else, we've tried everything. And we want to reach out to those people and say, come to Sinai, we think we can help you.
If our sickle cell team did not exist at all in this hospital, a lot of people would really just fall through the cracks.
When you have a circle of people that are all rooting for you, it makes you want to reach your goals that much more.
The Center for Sickle Cell Disease is a comprehensive program that delivers care for all aspects of sickle cell disease. We provide outpatient services, we provide inpatient services, we provide emergency services, we deliver novel medications, we offer counseling and support, and finally we do research.
The care that I received at Mount Sinai was definitely game-changing. Not only did I have a team dedicated to my care, I also had a community that I never had before.
We're part of everything for our patients because sickle cell can affect, unfortunately, just about everything. There's one place, Mount Sinai Center for Sickle Cell Disease, where if you need something related to your disease, we will have it.
At our center, the team is really one of our strengths.
This is a place where you know that every physician, all the doctors, they communicate and make sure that the care that's being provided is cohesive.
Every patient with sickle cell disease is different. There are no two patients that are going to be alike. Are we going to go on a clinical trial to try an experimental drug? Are we going to be creative about what hasn't been tried yet so that we can find something that is going to help you?
A person living with sickle cell, what they need from their care team is someone that's going to listen to what's going on with them.
I would hope that my patients would remember me as being someone who brought light to them.
They know me by name. It's not just, let's get rid of the crisis and it's done. It's how can we prevent the crises? Let's talk about what you do. Let's talk about how we can help you.
I would hope that when they see me, I'm a source of information for them. I can give them things that they may not be privy to. I can be a source of joy, just sharing something that makes them laugh in a moment that they probably were having a dark time.
Mount Sinai has given me hope because of the advances in medication, and it's promising a longer life for those of us living with sickle cell, which is something that we fear all our lives growing up.
We are in a place where there is more hope now than there has ever been. It really feels like we're on the cusp of something. We've got this 100 years of science where we understood this disease better than we understood any other disease known to man, but we didn't have treatments. Now we have the treatments, and it's really starting to lead to lots of therapies.
I have a lot of patients that grew up being told, you're never gonna make it to adulthood. Suddenly there's all this possibility. Suddenly a really long life is potentially ahead of them.
It's always a shock for so many people to learn that I'm still living, you know.
I'm thankful to everything that Mount Sinai has done for me and continues to do for me, because it's helping me to really see the world in a different lens and really feel confident that although I have sickle cell, it's not something that's meant to truly restrict me from living.
I wanted people with sickle cell, younger kids, children, teenagers, to be able to look at me and say, you know what, she's doing something that I want to do, or she's working, or she has a life.
It took a lot of work to not let sickle cell define me.
One of the things I hear over and over again is, I wish I had come sooner. And we're hoping to get the word out. Come see us sooner, because maybe we can help you too.
We all have goals and aspirations. We all have dreams. Your dream can be as bright as you want it to be.